Hi, I'm Dr. Matt Novarr. I'm an associate veterinarian at Columbia Pike Animal Hospital and Emergency Center. And today we're going to learn a little bit about dog allergies. Dog allergies are some of the most common things that we see on a daily basis here. And there's two main types of allergies that we see on a daily basis, one of which is food allergies and one of which is environmental allergies, and they might present a little differently. Food allergies tend to be year-round because the dog that has them is getting that food year-round, so there's constantly a response to that food that they're ingesting. Environmental allergies tend to come and go with the seasons. It's allergens that the dog's inhaling and their body has a response to. Both of these allergies can manifest by excessive chewing of the paws, chronic ear infections, scooting on the ground, and anal gland issues. Food allergies also tend to cause some digestive issues. Not always, but oftentimes. So if your dog is excessively chewing of the paws or scratching, there are great medications that we have now to treat dog allergies. In the past, years ago, we used to give them antihistamines, but what we're finding out is that dogs' allergies aren't mediated by histamines, so they need different medications to treat them. The newer generation of allergy medications for dogs are pills called Apoquel or a shot called Cytopoint. They both work similarly to decrease the chemical mediators of itchiness that causes your dogs to itch and scratch and chew their paw. And so oftentimes we diagnose allergies by their response to these treatments. In other words, if we give an Apoquel pill and the dog stops scratching and chewing, then we know they're dealing with environmental allergies or atopy, and we can manage it going forward. We don't cure that. We're treating the symptoms of itchiness. We're not curing the underlying allergy. And so over the years, the allergies might get worse. They might get more prolonged, and there might be more of a need to medicate to prevent the itchiness and self-trauma that a dog can do when they're dealing with allergies. The only cure for allergies is to go and get allergy testing done, usually at a dermatologist, and they can provide the dog with an immunotherapy that over the course of 6 to 12 months can desensitize them to the actual allergens that cause the itchiness. So for environmental allergies, we'll either give a Cytopoint shot or an Apoquel pill and see how the dog does. And if they get a lot better, then we know they're responding to the treatment for environmental allergies. For food allergies, if we have a dog that tends to have allergies all year round or doesn't respond to the Cytopoint or Apoquel that would treat environmental allergies, we might consider a food allergy trial. And in that case, we have to switch them to a strict hypoallergenic food for up to 2 months to evaluate for a response to treatment. So dogs that are dealing with chronic allergies are chronically uncomfortable. You'll sit there and you'll hear them chewing their paws, leaving little wet spots on the ground where they're licking excessively. And over time, as they continue to do this, they'll start to pull the hair out. They'll cause infections on their skin. And then we'll need to treat the infections as well as controlling the underlying cause of that, which is the allergies. Thanks for watching our discussion on allergies. If you are concerned that your dog is dealing with allergies, feel free to contact us. It's a frustrating thing that we have to deal with and a long-term thing that we have to deal with as well. So it's important that we come up with a plan for long-term management of this issue.